Complications of fillers such as Restylane, Juvederm, Radius, Sculptra, Fat, all the fillers have some risk of complications, and some of these include prolonged swelling or prolonged bruising, which is more to do with actually the trauma of injection and the needle than the actual material itself. And there's always a risk which you can minimize by taking a lot of precautions and discussing that with your doctor in advance. You can also develop infection such as a herpes breakout, especially in areas around the lip when a cold sore can come up after injection. Or you can get a bacterial infection, which typically is minor, like a mild cyst or a mild abscess goes away, but in rare cases can become long-term because of what we call biofilms. So excellent hygiene and care is very important before, during, and after the injection. There's always a small risk of improper placement, either too deep where you don't see the result, or too superficial where you can see a lump of the material. Some of these can be removed, such as hyaluronic acid fillers that can be removed with hyaluronidase. The others just take their time to go away. In the worst cases, they have to be surgically removed. There's always a small risk of occlusion of a blood vessel from the material that you're injecting, and that occlusion, if it goes towards the eye area, can lead to blindness. It has been reported in fat injections. It has been reported in Sculptra, but I'm not aware if they've been reported with the hyaluronic acid fillers or Radius for that matter. You can also get lumps and nodules from these at times, and majority of these go away on their own. I did not mention silicone because I don't use that in my practice, and silicone is a permanent filler. You can also develop sensitivity to some of these and develop a rash, and then in future you might not be able to use them. However, it is very, very uncommon. And those are the few things you have to keep in mind. One last thing would be, if you do get vascular occlusion that we talked about, it can also lead to skin necrosis because the skin doesn't get the blood supply in the area where the blood vessel was clogged. And that can develop into an ulcer and then become dead skin. Very rare thing. I've never seen it in my practice, but I've heard of it happening. Thank you. Thank you for watching the video. I hope you liked it. I love doing these videos, and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also, we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.